In this video, we're going to look at platelet-rich plasma injections or PRP injections for tendonitis or tendinopathy specifically. There are things you can do before you have the injection as well as afterwards that can actually improve your outcomes. So we'll dig into those. We'll also look at when the ideal time is to have one of these injections, how long you have to wait before you actually know whether it's worked or not. And then we'll look at what the research is showing, what types of tendonitis or tendinopathy does it work best for. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injury, all done via video call. We do specialize in tendon injuries. So if you want to know more about our online service, have a look at the description of this video. I'll put a link to the website there. I'm going to be talking about PRP injections throughout, and it stands for platelet-rich plasma injections. And the solution that they inject you with is actually prepared from your own blood. So what happens on the day you have the injection is the doctor will draw your own blood. They spin it really quickly, and that separates the blood out into different layers. And they then draw the layer off that has most of the platelets in it, and that's what they inject into the tissue. Now, why would they do this? How might it help a tendon injury recover? Our tendons do actually have the ability to heal all by themselves, as long as we provide them with the correct environment, which usually involves a reduction of load. So we're taking away the things that really aggravate them and just slowly rebuilding their strength. But sometimes this process doesn't work as expected, and the healing process stalls. And that's when you develop a chronic tendonitis or tendinopathy. Now, the reason that doctors and medical professionals are interested in platelet injections is that platelets have been shown to have the ability to release growth factors as well as substances that actually support the inflammatory process. Now, inflammation has got a bad rap through the years, but actually inflammation is a very important part of how you kickstart the healing process. And in animal models, the PRP injections have been shown to actually help with collagen production. And collagen is the main building block of tendons. So the thinking is that if you inject the platelet-rich plasma, it may stimulate the healing process and help a chronic tendonitis or tendinopathy to recover better. However, the research on humans aren't painting such a rosy picture. Some of the research studies are showing that yes, PRP can help with tendinopathies. Others are showing that doesn't really have an effect, no better than placebo. So what's going on? Well, it turns out that there are actually quite a few factors that can influence the quality of the PRP solution, how happy your platelets are to release their growth factors and everything, and how much of that they have, as well as things that you can do afterwards to improve the outcomes of the injection and how your body reacts to it. So we're going to dig into those factors today, and I'm going to divide it into 3 categories. The first category are things that you can do before you have the injection to give the platelets the best chance to be ready to help. The second category is all about how the solution is prepared. And then thirdly, we'll look at the things that you should be avoiding as well as be doing after the injection to help your body respond to the injection in the best way. The interesting thing is that even if you draw blood from the same person on 2 different days and prepare it in the same way, so the only difference is that it's on 2 different days, the platelet solution can actually vary quite a lot with regards to how many platelets is in the PRP solution, the quality of the platelets, how readily they can release the substances they have to release, and how much of those substances they have to release. And this is because there are quite a few lifestyle factors that can impact these things. So let's have a look at those. The first is mental or physical stress. Now, we're not talking about chronic stress in this instance. We're talking about a single, quite significant stressful event. So if we think of mental stress, it's you have to deliver a speech in front of people that you're really stressed about. Or physical stress, it would be a really hard workout that pushes you to your limits. What happens then is your body platelets naturally releases their growth factors and all those pro-inflammatory factors to help you recover from that event. So if you draw the blood shortly after that, they just don't have much to give anymore. So it's best to not schedule the injection for shortly after a really stressful social event you might have or work event you might have, Or just keep your exercise easy for the days leading up to the injection. What you eat or drink can obviously also influence it. And here we have the usual suspects of a bad diet. Diets high in saturated fats or refined sugars, refined carbs. High in caffeine can influence platelet health, but then some healthy foods may also have an influence. Apples and onions, if you have loads of that shortly before the injection, can be a problem because they contain a substance called quercetin, I think is how you say it. I'll write it up here, which may influence the platelets. There are also substances found in soy as well as chickpeas that's usually good for the body, but they have an effect on the platelets that we don't want for the PRP solution. So it's not about getting your diet perfect and every single thing perfect here. It's about avoiding extremes. Having small amounts of this in your diet leading up to it, not a problem. But if you can have lots of all of these products shortly before in the days leading up to the injection, it might not be that good for it. Smoking and alcohol, not great for platelets. And when I say smoking, don't just think that it's the smoke that's the issue. If you're using any nicotine products, you're likely affecting the quality of your platelets because it's the nicotine that plays a big role in all of this as well. So nicotine patches, vapes with nicotine in it, I would be wary of any of those. Medication can also influence your platelets, and the most obvious here are anti-inflammatories, antihistamines, as well as antibiotics. Now, some medications you can stop without an issue for a while before you have your injection. Others, like antibiotics, shouldn't just be stopped without consulting a doctor. So you just need to think about when is the best time and timing with regards to when you can stop your medication versus when you have the injection. There are currently more than 16 machines that can be used to prepare the solution, and they all have a slightly different number of platelets and things in the end result that they produce. Some doctors spin the solution twice, others just once. There are also different substances that can be added to the platelet solution to allow them to more readily release their factors. And the problem is at the moment, there's no evidence in the research for any of the methods to be superior. So we don't know what the best method is. My advice with this is do not worry about this too much because we just don't know what the best method is at this point. If you seeing a reputable doctor, they will be using a good machine that's good enough, and they will be preparing the solution in a method that is good enough. So I wouldn't worry about this. I would concentrate on the things you can do before you have the injection and the things you should be doing after the injection to optimize the results. PRP injections are different from other types of injections. It's not a substance that you inject and then you can just sit back and that thing does its job and it works out after a while and then you have to have another one. It doesn't work like that. The PRP creates the environment for healing to happen, but then you still have to do the things that stimulates the body in the right way to actually signal to it to start the healing process there. Let's start with the things you should not be doing shortly after the injection, and then we'll get to what you should be doing. So the things to avoid is anti-inflammatory medication, at least for the first 2 weeks. It should be okay after that because the inflammatory process should be complete after that. And this is basically because the platelets are meant to stimulate inflammation that's positive for healing. So if you're now going to have anti-inflammatory medications, it's going to be counterproductive. Ice is a bit of a controversial one. You will see people on the internet shout about don't use ice for this and this injury because it can suppress the inflammatory response. There isn't any evidence in humans at this point that short periods of ice can actually cool the tissue enough to affect the inflammatory process. And we don't know if it will have a negative impact on PRP or not. Even the experts in PRP injections are divided on this. So the current thinking is that it's likely best to avoid cooling that area significantly for the first 2 weeks. If, however, you have quite a lot of pain and it is a significant flare-up after you have your PRP injection, which is sometimes possible, then applying ice for short periods of time, 10 minutes at a time, is likely not a problem. But submerging the whole body or the whole limb for more than 10 minutes in really ice-cold water is likely not ideal. So placing an ice pack on there for 10 minutes at a time is not needed for recovery. Best if you can avoid it, but likely okay if you need it for pain relief. I mentioned earlier that the PRP creates the correct environment for healing to take place, but you still need to give it a stimulus, a mechanical stimulus, to tell the brain and the body to actually strengthen and renew the tendon cells. There's an interesting research study that came out in 2026, the year I'm making this video, where they consulted 23 experts, they're medical doctors who specialize in PRP injections as well as sports rehabilitation. And what this group highlighted about PRP injections is the importance of following a progressive loading plan after you have the injection to stimulate the tendon to actually react to the injection in the way we want it to react. So what's mechanical stimulus? It's basically just that when we use our body, any tissue in our body, but tendons specifically here, the fact that there's pulling and strain going through that causes micro injuries to that tissue. And those then signal to the brain that it should come and renew those tissue and make it stronger because you want to be doing more with it. So if you just sit back after you've had a PRP injection, you might get a bit of symptom improvement, but you're not going to get that full strength you will get and full benefit you will get if you don't do the strengthening plan. And also, it can't strengthen the tissue to the point you need it to be for your sport or just the work activity or anything you want to be doing if you don't actually follow a progressive loading plan that builds up to that. There is no such thing as an ideal rehab plan after you've had an injection. There are certain factors that I will discuss in a minute that the plan needs to have, but where your plan starts, the exercises that's included, how quickly it can progress, and what level it builds up to, all depends on you, because where you start will depend on how strong you are at that moment and also how painful your tendon is. How quickly you can progress will depend on how quickly your body responds, and we all respond in different rates. And the level you build up to will depend on your ultimate activity goal. So if you just want to walk your dog, your plan will look very different from somebody who actually wants to do a high-level sport or has a physical job they want to get back to. So this all has to be taken into consideration when your plan is created. There are 4 principles that needs to be applied in every single rehab plan. What they look like will differ, but they all have to be there. And the first is that you do have to take things easy for the first 7 to 10 days after you have the injection. And this is to allow that initial inflammatory reaction from the injection to just settle down at the rate it should settle. If you do too much too early on, you can actually cause an excessive inflammatory response, which is also not useful. Depending on the tendon that's been injected and your specific case, how severe it was beforehand, or just the protocol the doctor wants to follow, they may even put you in a brace for that amount of time. Then the next step is, as soon as you're allowed, you usually ease into gentle strength training. And this follows exactly the same type of pattern that you would follow with regular tendon rehab, that you start with low load isometrics. If it handles that, you slowly increase the load, start working through range, eventually end up with explosive exercises and high intensity exercises. But this obviously depends on the goal of the person. And that's the third factor that's important, is that the level of strength you build up to and skill you build up to should be determined by what activity or work or sport the person wants to get back to. And then finally, when you're ready to go back to work, when you're ready to go back to your sport, you can't just start it all immediately at full force. You have to ease back into it slowly, because that provides the last level of strength and endurance that you need. If you're looking for specific advice about rehab plans for different types of tendon injuries, as well as treatment in general, we have got loads of resources where we've discussed that in detail. Have a look at the description of this video. I'm going to put links to those there. How long do you have to wait to know whether the PRP was actually successful? Well, the problem is the initial reaction can vary quite a lot between people. Some people have an immediate reduction in pain. Others don't feel much different afterwards. And then others have quite a significant flare-up in pain for quite a few days before it settles down and calms back down to their previous pain. You cannot know from this initial reaction how successful the injection was or not. The body takes time to actually react properly to the injection and strengthen by following that progressive rehab plan. So you have to wait at least 12 weeks to know what the outcome is, which makes it a bit frustrating because people like to see immediate results. But in my experience, it's only after 6 weeks that patients often start seeing, oh, I'm finally progressing when I couldn't really progress before with my rehab. And this is also supported by the experts in the consensus statement that they said you should wait at least 12 weeks and make sure the patient follows a progressive rehab plan in that period before you review them to decide whether another injection is needed or not. If you do another injection before that, you're doing it blindly because you don't actually know what the full effect has been of the first one. Having a PRP injection too early after your tendon pain starts is likely a waste of time. Like I mentioned before, your tendon has the ability to heal by itself as long as you give it the correct load management and careful reloading plan. So the advice at the moment is to wait at least 12 weeks of following the correct plan before you consider having a PRP injection. And then it's only useful if you're not actually seeing results with your loading plan, or say it's even longer than that and you have seen results, but now you've plateaued and you're just not getting over a certain level of discomfort or being able to go up the next level, regardless of everything else being correct that you're doing. Then PRP injections may be a useful adjunct to treatment. So it's not something we'll say everybody should have, and it's definitely not something to have within the first 12 weeks of your tendon pain starting. But if you find that you're stuck, then it is something to consider. Usually, I discuss the research at the start of a video, but in this case, I left it for last because I wanted you to first understand all the factors that can influence the outcome of PRP injections before I discuss the results. Because at the moment, the research into PRP injections for specific tendon injuries doesn't really show very strong indications that it's useful to have. But the problem with these studies is that there's no standardized method in them. They all use different ways of preparing the PRP solutions. There's no mention of anything that they've told the patients to do or not do before they've had the injection. And they don't really mention what they tell the patients to do after they have the injections. So, in my opinion, there are too many unknowns that could be affecting the outcome of the PRP that we can really say that it's useful or not. But if you want to know the research at the moment, it's showing that PRP injection is very likely useful for gluteal tendinopathy, tennis elbow, plantar fasciitis, as well as patellar tendinopathy. There is some low-level evidence that it might help with rotator cuff tendinopathy. And then for Achilles tendinopathy, it's actually showing that it's not really that useful. And the types of tendonitis or tendinopathy that I'm not mentioning hasn't actually been researched at all. If I had to just look at the research studies, I would say at this point that PRP might not be that useful to have. However, like I said, there are big issues with the research, and I don't feel they're doing PRP injections justice at this point. So at this point, our advice is PRP is likely not for everybody. It's definitely not something to try within the first 12 weeks of your tendon becoming painful, because it's likely a waste of time and money at that point. And if you do feel that you're stuck and you're not really able to make progress with your rehab, or you make progress and you get stuck then, it is something to consider. Brilliant. Hope you found that useful. Let me know in the comments if you've got any questions. And if you need more help with your tendon injury, you're welcome to consult one of the team via video call. The link to our website is in the description of this video. Take care.